Let us study about bronchopulmonary segment. Bronchopulmonary segments are well-defined, wedge-shaped sectors of the lung, which are aerated bronchi. This is trachea, which divides into two primary bronchus. Right side lung has 3 lobes and left side lung has 2 lobes. So the primary bronchus will divide into 3 secondary bronchus in right side and into 2 secondary bronchus in left side. Bronchopulmonary segments. There are 10 bronchopulmonary segments in right lung as well as in left lung. I will tell you an easy way to draw bronchopulmonary segments in right lung. First we'll draw right lung here. This is a right lung and this is medial side, and medial side will be that side, and this is lateral side, and this is a lateral view. We'll draw segments in right lung. First we'll draw a Y shape here. This is almost like a Y. This Y. One Y, and there will be one fissure here and one fissure here. This is Y. And when you will through from this side, and here it is an A. Y. Y A. And here we have to draw a pi. Pi, a maths pi. These are the segments in right lung. And now we'll name, this is at the top, so it is apical, and this is anterior, posterior, this is medial, and this is lateral, and this is superior, and it's anterior basal, posterior basal, lateral basal, and one more will be there, medial basal, that is on the other side. Through the lateral view we can't see the medial basal. Apical, anterior segment, posterior segment, superior segment, posterior basal, lateral basal, anterior basal. This is medial and this is lateral segment, and medial basal will be on that side, which we can't see through the lateral view. Here is an easy to draw Y and A pi. Through this we can draw segments of bronchopulmonary segments in right lung. This is an easy way to draw segments in a right lung. Now we will draw left lung, bronchopulmonary segments in left lung. This is a rough diagram. Left lung, lateral view. There will be only one fissure in here in the left lung, whereas there were 2 fissures in right lung. See, this is one fissure and this is one fissure. There were 2 fissures. There were 2 fissures in the right lung, and here it is only one fissure in the left lung. And again here it is Y. Y, and we have to again here a pi. Here just a 2 line. And these are the bronchopulmonary segments in the left lung. Okay, now we'll name bronchopulmonary segments in the left lung. This is the topmost bronchopulmonary segment. This is apical. And this is anterior segment, posterior segment, superior segment, anterior basal, lateral basal, posterior basal, and again one medial basal will be there, that will be on another side. And this is superior and inferior lingular bronchopulmonary segment. It is very easy. Here 3, 4, and these are 5 plus 5, 10 bronchopulmonary segments in left lung and 10 bronchopulmonary segments in right lung. Total there are 20 bronchopulmonary segments in a lung. Okay, bronchopulmonary segments in both almost have similar name, like apical, anterior, posterior, superior, anterior basal, lateral basal, posterior basal, another medial basal, and this superior inferior lingual. These are only two new names in the bronchopulmonary segments of left lung. Each bronchopulmonary segment will have its own artery and a segmental branch of pulmonary artery. Each segment it has its own lymphatic drainage and anatomic nerve supply. So this will help during surgery. These bronchopulmonary segments have surgical application. So as each bronchopulmonary segment is supplied by its own pulmonary artery and its segment and segmental branch of pulmonary artery. So during any surgery, if you remove one pulmonary segment, it won't affect any other segments of lung.